the thing that just came before this. I see Amy has started the recording, so a reminder that we are recording this meeting. We have a really full agenda for today, so I won't belabor us and take up too much time. I just want to start always by thanking you all for your participation and your continued presence, both at these meetings and in our interim time where you have been doing your work in work groups and subcommittees. So thank you so much for that. And to the staff who have been supporting us through this process. November, we honor and celebrate Native American Heritage Month, and so I want us to honor and celebrate that as we acknowledge the land and the Pueblo and Navajo and Apache peoples who are the traditional custodians of our land since time immemorial. And we honor their deep connections and significant contributions that continue to make contributions to our state now and going forward. And so as we prepare today for our meeting and kind of grounding us into the importance of a racial justice council is really reading all of the reports and the work that all of you all have done. I've been really inspired by all of the work that the subcommittees and the work groups have been sending out. We know that some of the reports you are just receiving and may not have yet had the opportunity to read in full. And so we're going to move through the agenda this evening. And I'll ask if you have a moment to check your email, as you'll see some of the reports that have just come out today in your email. So with that said, we will move first to the work group on excessive versus deadly force, and school restraints and seclusion, which was Dr. Romero, Rabbi Linick, and Ibukun.
Thanks very much, Alexandria. I'm going to very briefly present this material. I want to say just at the beginning that I'm sure everyone heard about the FBI hate crime statistics report that came out on Monday that reported a 10-year high in hate crime in the United States that is vastly and primarily directed toward communities of color, just to underscore the importance of all the work we're doing. I also think it's important seeing the prodigious amount of work that has been produced by this council in such a short time. I know for us in our subgroup, we're just blown away with the incredible creativity and the knowledge. So I want to say more than that, but I felt like it needed to be said. So congratulations to everybody for everyone's work. Regarding Senate Bill 17 and 284, we're recommending to the governor that they both be advanced through the legislative process. I'm going to start with Senate Bill 284 because that's much more straightforward, dealing with restraint in students in educational environments. The bill is being recommended by school superintendents across the state, provides structure and accountability to those encounters and relationships, protecting both students and school officers involved in the encounters. Our one recommendation for this bill is that the statute be strengthened to include support protocol for both student and SROs involved in the encounter, because it's our belief that those with authority are also bearers of the stress of these encounters. And so we think the bill could be broadened in a very effective way. A lot of the things in the bill are already codified in school districts. And what this bill does is it actually formalizes this protocol and creates both reporting and conduct guidelines for these encounters. And ultimately, the law will improve individualized education plans, which we think will improve outcomes for students and all who are involved in nurturing our students through the system. So that's what we would say about Senate Bill 284. Senate Bill 17, we have a lot more to say about. We feel that it's a good start to what needs to be a more in-depth conversation particularly about the definitions of excessive and deadly force. We are attaching 3 pieces of legislation, one from California, one from Colorado, and Vermont, that are really full-blown, well-developed excessive force statutes. They're the only 3 states in the United States that have such expanded statutes. And our recommendation is that the sponsors of this bill look more deeply to expand the scope of the bill as they've written it. They've given some guidance, some jurisdictional guidance. They've given some reporting guidance. But we feel the bill needs to address context and overall circumstances for when these excessive force encounters take place, that place more burden on law enforcement officers to be accountable not only for their actions, but for the condition of the victims in their charge. We also feel that the law lacks any depth in discussing compliance or potential recourse for non-compliance. So we feel that this represents the kernel of what could become an excellent piece of legislation, but we recommend the governor encourage its advancement with some much deeper development. We did get a lot of input from law enforcement agencies, including police departments, from the judiciary, and from the defense attorney bar. And the thing that stood out in the feedback received from them was law enforcement feels that these issues can be dealt with on a policy level, not with legislation, and that the solution for standardizing police practices with the use of force should be found in accreditation procedures. We're recommending that that's not adequate and that the law should expand beyond policy and accreditation. I would say let's make it short and sweet. We recommend both for advancement. We would like to have had an opportunity to talk in more depth with the sponsors to understand why they composed the bill with such a limited scope. That may have to do with their perception of the politics, what's possible, but unfortunately we didn't have that opportunity. Open it up for any questions or comments.
Thank you, Rabbi Lennick. Are there any questions or comments for this work group?
Awesome report.
Thank you.
Thank you.
Had a great team.
We appreciate your work on this. No questions or comments for this work group? Mr. Sanchez.
I'd make a motion. I think this is such a straightforward pieces of legislation. I think we have consensus. I would make a motion that we vote to see if we have that consensus and send this on to the governor.
Thank you, Mr. Sanchez. There's a motion. We moved in and out of Robert's rules of parliamentary. Do we have a second?
Second that motion.
Thank you, Bishop Cooper. Are all in favor or agreement?
Aye.
Awesome. Any nays or anyone in disagreement? Well, thank you to this work group. We will add this to the reports that are being forwarded to the governor's office. Much
Congratulations for advancement of this legislation. Thank you for your hard work on that.
Absolutely.
Let's see. I'm just looking at the agenda to see who we have with us that can present next. It looks like we can move to the permanency of the Racial Justice Council. Dr. Sanchez, Dr. Becknell. Are you prepared to present?
Yes, trying to start my camera. All right. Okay, so the subcommittee for the permanency of the Racial Justice Commission looked at various legislation and processes across the country. Can you hear me? across the country. This was compiled by Kevin Beltran, who is a support staff here at Te Women United. And so we did an extensive search. Probably could have included more, most definitely. But we found and landed on 2 states, California and Washington, who have put forward legislation and working towards a process. And this is like a 5 to 15-year process for both of those states. And they were both looking at the establishment and creation of an Office of Equity within the governmental structures of those states. So what the Permanency Committee is recommending is that we establish, and we also had presentation from Mr. Raul, I cannot say his last name, Barrigas, who helped us understand the structures within the state government around commissions, boards, task force. What we learned is there's over 300 of those in existence, or a little less, little under that. And so we landed on a commission. So a commission with looking at a sunset term of 10 years, because we know that these issues to address equity, racial equity, especially systemically within the state governmental structure, is going to take time. And so we're charging this commission with cultivating a unified definition of racial equity that can be utilized across the systemic systems of the state government of New Mexico, that it be driven and informed by data, and that we look at healing aspects in this work around racial equity within the state of New Mexico. But this commission, Racial Justice Commission, would be carrying forward the work of this Racial Justice Council, would go into effect, would have this 10-year sunset term, which would go 10 years, or would dissolve with the establishment of an equity office within the state of New Mexico. We're asking for some resource money support for staff and consultants within this commission to undertake this. There is extensive research from California looking at Washington and following their process around this particular piece. There are definitely challenges to that as well. But if we're really looking at systemic change within the state of New Mexico, that must come from the top down through all the offices and departments and agencies within the state of New Mexico. Does anybody else want to add some comments, questions? Why we chose a commission with a term or a sunset term as opposed to a task force is looking at the challenges that came from those 2 states in their process, mainly Washington, though, was a quick pace of the task force. It was a limiting factor for community voice, really engaging community and getting their perspective on a process that would really inform what the state government was pushing out. And the ability to have coordinator and consultants to bring in within that process. And so that is our recommendation. Washington State, if you look at the briefing, passed this, signed this into law in 2020, and then they were hit with COVID. So they had been given $1 million to get this office started. In their process prior to that, before it getting signed into law, why they chose a task force was because they wanted to ensure the previous year it did not pass, and they wanted to ensure that it would go through within the next couple of years. And so that's why they established a task force to continue to carry that work forward.
I've got a question. So I'm in favor of this. It's a great idea, and I support it. And maybe I missed this somewhere in the paperwork. So 2 things. One is who does the appointing of the commission, and the second is that I don't think we can make the assumption that this group would be the commission, because sometimes you see groups trying to make themselves permanent. I think it most likely will be these same members, but that it needs to be clear that there'll be a reappointment in that. Those two pieces. So who does the appointing?
Yes, and this is the conversation that we had with Mr. Barrega around like the appointing bodies. And I think we left that open for discussion within the council to really determine that. What we said what we're recommending is a mixture of members of the legislature, the governor's office, and various commissions that currently exist, like the Human Rights Commission, the Civil Rights Commission, and the Martin Luther King Commission, as well as community representatives, which could follow the criteria of this Racial Justice Council. And we're trying to identify that piece of who would do the appointing. We could make the recommendation to the governor that it be the governor's office. We could make the recommendation that it be Senate and or a legislative body. And so that is where we kind of ended up with our discussions on this particular piece. One, due to my inexperience within this whole structure of the processes and the time frame that we're looking at. So sorry, I couldn't answer that better. And then this is where we are hoping for some guidance from Amy and others within the process to help us narrow that down.
Do others have comments about this topic specifically around who appoints to the commission?
Madam Chair.
Hi, Senator Lopez. Do you have a comment for this?
I appreciate, thank you first.
Yes, now.
Can you hear me?
Yes, it got frozen for a little bit. You're good.
Hear me now?
Yeah, I think that's better.
Okay.
Better, Senator.
I may take myself off from. I'm going to take myself off video because that may help also. First of all, thank you for the presentation and yay. And as Mr. Sanchez did mention, you know, the devil is in the details and who the appointing authorities are. As chair of the Senate Rules Committee, we deal with the boards and commissions for the state. And of course, recommending this to the governor, so it'd be up to her staff, of course, and her as to what their idea would be. But you can do the mix. The appointees, there could be some that could be publicly appointed, which would be through the governor's office, and there could be some that could be legislatively appointed also. So we've had mixtures of that too. So that way you both have the executive and the legislative branches that are appointing. So there's a flavor that could be, but I guess that will still be as, you know, our presentation is made to the governor and then some more talk on that and on the meat of the bill. And then we've done something similar in the past too, Madam Chair, Dr. Sanchez, is that if a bill isn't able to make it through, you know, of course, this year we don't have much money. We're still hurting for cash within our state coffers. So even looking to see that maybe to get this started before it's fully funded or fully up and running with staff and such. That may be a caveat that could be worked out with the governor's office also, at least to get this begun. And if there isn't the movement on that, then of course the continuation of a task force is another way to go. We've done that many years in the past too, through the legislature. So there are ways that we can continue the work of what this advisory council is doing. Just wanted to mention that. Thank you.
Thank you for that, Senator Lopez. Any other comments?
Thank you. Can I also add that we were unsure, and I am around the state and private sector collaboration. One, because there is a funding opportunity for Kellogg around racial justice, which is, you know, has potential funding of millions of dollars. And so if there is this collaboration within the private and state sector, that we are looking that we could supplement the funding that we're asking for these critical staff positions to really help solidify this process within our state structure. So that was just a proposed opportunity, and I don't know. I'm not too familiar with governmental structures to see like if that is a possibility, but I feel like it's a multi-year funding opportunity, which I think we would be able to make a huge impact on.
Yeah, I think that was a really important addition to the report. It was good that that was included in the report, and I think that that was initially some of the conversation when the governor's office first engaged in this work, was looking at private governmental partnerships. So I think that's really important to include. I wanted to go back to Mr. Sanchez's question to ask whether we wanted to include some language in here signaling that the council would still be discussing or making a recommendation around who appoints the commission. Or did we want to try to have that conversation now and put that language in there? I was looking at the attachment that you all sent that shows the different commissions and the different appointing bodies, and it looks like there are some that have that mix, like Senator Lopez was discussing, and some who are just governor appointed, but also include state agencies such as Indian Affairs and the Office of African American Affairs as well, not just the executive and legislative bodies.
Yes.
So would we like to add some language now or put a placeholder saying that we will be discussing that further?
Madam Chair,
Okay.
I'm sorry.
I was just going to say I'm open to recommendations from the council.
Madam Chair, Linda, this is what I would, there's so many different ways that we could do so. But what could be spelled out in the legislation, because the governor would be making the appointments within the governmental structure, for the executive. So we could list to make sure that there are representatives from, Department of Indian Affairs, Office of African American Affairs. And we can specify that, which I think would be good, because if you leave it open, successive governors may not have the same commitment, and they could put together a whole different group that would look very different from those of us who are here today. So I think in my suggestion is that we would list specifically, with some specificity, as they say, from what departments, and still, leave it open for the governor to do what she or he would, for future years to do. But I would venture to say that let's put some specificity, and even for public members, if the legislature is involved, that they still have to meet maybe like different quadrants of the state. So you have urban, quote unquote, versus rural, representative from Indian country. We could define some of that and I think that would be appropriate, especially for the work that this council is committed to doing. Because if we don't specify somewhere in there, it can really be, they could play with it, and it would not, I think, do the intent of what we want to do. Just wanted to mention that too. Thank you.
Thank you, Senator Lopez. That sounds really important. And I'm thinking that what we do is we move forward with the work group's report, and at our next meeting, we add this as an agenda item as one of the priorities that we want to discuss around exactly who that group is, and if the work group members would be willing to even come up with a suggestion based on your research and your work on this, then we can finalize that portion at our next meeting. Okay,
we will definitely do that. Thank you.
I keep giving you more work. I apologize. Moving along.
We wanted to hear from the larger council on that too. Thank you.
I also want us to remember that this is where we're finalizing proposals to go to the governor. And so if we want that included, and what's going to be sent to the governor, we need that language before the next meeting. We need that language by Friday morning. And so it's fine to add it in as draft language, or to add in that we would like to see multiple different ways of submitting names or of having appointees, but we will need the language by Friday morning.
Okay, we'll work to get to that language by Friday.
Yeah, I appreciate that. With that, are there any more comments or questions or discussion regarding the permanency work group's report? All right, seeing none, do we have a motion to move this forward?
So moved, Madam Chair.
Thank you, Senator Lopez. A second.
I second.
Thank you. All in favor? Anyone opposed? Just checking the chat. All right, thank you. We will move that permanency work group's report forward. Thank you for your work on that. It was really wonderful to see that and to think about how we institute this work into our state government. Okay, so moving forward, we have the report out from the work group on renaming state parks and places. We have Jacqueline, Dr. Sanchez, and Fatima.
Okay, hello again. So the subcommittee on renaming parks and places has a recommendation to convene a task force and putting this forward to the governor around a process, and we're looking at compilation of geographic information, description, analysis of public places and names and monuments, prioritizing key contested places, names, and monuments, and to conduct community hearings and healing gatherings. And we understand that task forces can have, they usually have a quick turnaround from our gathering of information. And so we're looking at a 2-year process within this so that we can really honor and give voice to community perspectives. We want to be able to, hear from community and also offer up suggestions around what could be possible as replacements. What we see in the research is challenges around other areas and places in the country where teachers and educators are challenging renaming or getting rid of those statutes and monuments. We have some processes like the Truth and Reconciliation process in Greensboro, North Carolina. I think across the country, people are currently still struggling with this issue. And so this also allows New Mexico to kind of get on the forefront of this issue within offering recommendations to the state and how we move forward. So we're saying a task force, and here we name potential task force members. So 3 from the Governor's Council, this current Governor's Council, or iteration of what this may be. Dr. Patricia Trujillo, who's the Deputy Secretary of Higher Education, Dr. Tessie Naranjo, Glenabel Martinez, Vanessa Francesca Chavez, who did a book most recently around conquistadors and New Mexico. And so we're just trying to engage different scholars, different community members, representative from the All-Indian Council of Governors, UNM American Studies Department. So those are just suggestions. We would like, to have also some commitment of funding to support this, at least an initial offset to get that going. Again, we're also recommending a private and state collaboration. The Mellon Foundation has an initiative out there to the millions again around this particular issue of statue and monuments. And they're looking for places across the country who are pushing this forward and are doing this. So we're saying, seed money from the state to staff this process, looking at technical assistance firm, which is really like a facilitation consultants to help these community conversations to happen. Surveys in different ways, ways that community can participate. And so that was our recommendation as quickly as we could get it to you all.
Thank you so much. I could give Jacqueline or Fatima a moment if they had anything to add.
Just, I guess just a follow up is that knowing that Amy needs this by Friday, and we would like to just make sure that you all have a chance to look at it and provide feedback here and, you know, after this meeting. And we know that this list of potential task force members is incomplete. I know we wanted the Office of African American Affairs also representatives, and I think it got lost in the editing process, but there are definitely folks missing. So just to really make sure. And then Senator Lopez, hearing what you said about there are budgetary constraints and making sure that we need funding for this and what can we do with limitations around that. So making that clear too. And Jacqueline, did you want to add anything?
Yeah, I think just wanting to reiterate that like our approach in putting together this recommendation really came from how we could create a process-focused solution toward community dialogues with the goal of really centering community healing and dialogues, like in this reimagining of what our space could be without these racialized like tensions that exist today in the landscape that we have. And so it's very much from that process-oriented perspective that we're like recommending this to the council.
And then you'll also just see language in the recommendation that we've seen, as Corinne mentioned, that this is nationally happening. You know, that in most communities across the state, there's a lot of conflict around place names, around monuments. We've seen this in New Mexico with the removal of the Oñate statue in Alcalde and then the shooting in Albuquerque. So there is a real implication, you know, statewide. If there isn't action taken around this, we see that there's just instability. The obelisk here in Santa Fe was also taken down by a group of activists in an unauthorized way. So we're just really encouraging a commitment around this as a demonstration of towards racial justice and inclusivity for our communities, because we know that place deeply matters and seeing how we're reflected in place matters, and that it's currently very unequitable.
I just want to reiterate part of our conversation too around this is that so much of the ways and portrayal like of this very oppressive like history and past, and how within that there is an elevation of the myth of like the tricultural and the way that that in and of itself like leads and contributes to anti-Blackness in New Mexico, leads and contributes to the erasure and invisibility of many of our other communities that are so much a part of the fabric and strength like, of what New Mexico is today, and it gets lost like in that in who we choose to quote unquote honor. So I think it's really something that we want the process and the focus to be intersectional, and we see this as a way of moving us toward that.
Thank you all so much for your work on this. Mr. Sanchez, I saw your hand, and then Councilor Bencomo.
Yeah, I want to congratulate you. This is a very difficult topic, an important one, very, very important. And like Jacqueline said, I was very happy to hear about, the healing. Somebody we need to add to that list is Regis Pecos. And I worked closely with him when he led us in a group that we pulled together when they made the changes for la entrada of the Fiestas de Santa Fe, which, as you know, also a very difficult process, but I think some healing and some good changes took place and more need to. But we got to really go forward with this. First, I think emphasizing like you're doing with the healing. The healing will lead us to the name changing, but we've got to really emphasize that healing, and I just want to emphasize that. And then really recommend that we right away put on that list, so he's on the radar, Regis Pecos from the Cochiti Pueblo. that experience, we can learn from it and we can go forward on this. So I support you very much and thank you. This is a very difficult piece of our work. And then whatever that task force, who they are, they're going to need a lot of support from this group if it continues as a commission. Thank you.
Thank you. Did anyone want to respond before Councillor Bencomo speaks? Okay, Councillor Bencomo.
Thank you, Madam Chair. Yes, thank you so much for all of the presenters today, but definitely for you all in this group. You know, I am one question that came up here in Las Cruces during the conversation to get Oñate High School renamed, which it was renamed. But one of the biggest things that happened was that a lot of people felt like it was the right thing to do, school board members, and they were being faced with the cost of it all, right? And so I'm curious about if you all had that conversation. Not by any means that I don't like healing takes money, right? Like it's going to take money to make sure that people feel good and welcome in their home and to really remove some of these things. So I'm not by means saying that's a barrier. I'm just curious if you all had those conversations and what those were like, especially right going into a budget year that's difficult for the state. So I'm just curious. Again, I'm totally supportive of this, but I just wanted to ask the question since I know that's always something that comes up.
Yeah, this is something that we are conscious of, but really without the inventory or understanding of how many particular places this means to really figure out that cost analysis. And so that's part of the task force would be looking into that. And also why we're suggesting that private state partnership for other resources that may be available for us to do that and think about it. We very much understand the position that our state is in with COVID currently and access to resources.
And I'm just seeing the comment from Dr. Patel in the comment box in the chat box, and it's a similar question, I think. And similarly, there is language in there, but maybe we can strengthen it. As Corrine mentioned, as Dr. Sanchez mentioned, the Mellon Foundation and Kellogg both have funding available, so there is potential for partnership and grant funding for this type of work, kind of from national funding sources. And just to say, you know, as you said, you know, healing isn't free. It's really challenging and it's a difficult decisions to make, but we do, you know, budgets are a reflection of our values, we know.
Yeah, that was a good conversation. I appreciated you all actually including those different opportunities in the actual proposal so that you can really see what's potentially out there. I had a question kind of in follow up to that. If you all had any discussion around whether we would be asking the governor to take an executive order action on this, or were you hoping to see this as kind of like a memorial created through the legislative process to establish the task force?
Again, this is where we would like to hear from our representatives and senators that are on the council to really help us understand which would be the most impactful to ask for.
I think also adding to that, there is the reality of recognizing that while an executive order can be fast and effective, that doesn't mean that healing has occurred, right? So from like a community, like organizer, like cultural worker perspective, like there still is a need to be able to facilitate dialogue with communities so that we're fostering understanding and like shared story and exchange so that it does, and our opinion really is like both and needing to, for us to create transformation is really like the idea is like, how do we create and reimagine like transformation? And then also, how do we create through this process, like, what does it mean to honor different community members moving forward? And so, you know, our focus again is on that process. knowing that we're looking at 2 years, but that realistically, we know that this work is, it moves at the speed of trust, it moves at the speed of community, and all of that takes time and also resources.
Yeah, thank you for that. Senator Lopez, do you have something to share?
I can offer, and I appreciate, and thank you first of all for your proposal. I think it's right on point. And I noticed that Austin Wiaki has mentioned about no time for memorials at the 21st legislative session. That hasn't been decided yet. So we've talked about it, and this session is going to be different. And we don't know at this point what we're doing, if it's hybrid, if we're just going to be total virtual or what. So we'll still be waiting until after the Christmas holiday, I think, in quite honesty, to see what COVID's doing in our communities. Because if you notice, today's numbers are much closer to 3,000 cases already. So it's, Christmas holidays are coming. We're creatures of habit. We get together. So, I mean, there's still issues that we have yet to decide. But on that note, I do believe that memorials, Senate joint memorials and House joint memorials provide they have a certain function within our system. So we cannot, as a legislature, say no memorials at all. So that's an argument I will make in saying that we still have important work that needs to be done. And task forces and such are the ones that we put together through this type of enactment through a memorial. What could be suggested is that the governor could make some appointments to a task force as well as the legislature, again, to include certain members, certain persons, certain areas of our state to be represented. At least this is a planning function. To make it permanent, we could also try that too. But again, with the issue of funding, and I just want to reiterate, right now our budget is not as solid as I would love for it to be. And with our closing of businesses and other things that are still happening, we have to be very cautious with our budget. But I do believe we should start this and move this forward. And of course, with the governor's seal of approval on it, that will also help in the legislative process. And I would venture to say that to get some good dialogue, because the legislature also needs to be part of this conversation and healing, and also for some, maybe a learning curve on what needs to happen. I would venture that we would have a very interesting and, how would I say, energizing conversation on the floor of both chambers with regards to a task force. And I think it's imperative that we do have this conversation because it's necessary, because as the elected leaders of our communities, we need to be engaged in this too. So I hope that helps a little bit. Okay, thanks.
Yeah, thank you, Senator Lopez, for that advisement. I think that gives us a lot to discuss. And Austin, I wanted to give you an opportunity if you wanted to share your important comments on mic, or if you're able to share your important comments on mic. I do think it's important for us to decide what the ask of the governor is, whether to support this as a joint memorial or take executive action, or both. But I think having that direct ask is really important to us seeing this important work move forward. So I'll open for any conversation or debate on that.
I like Austin's comments that it be both. I think because of the systemic nature of what we're dealing with, that we do need to see this coming from the governor's office as well as the state legislature. And so ways that we can show that this is, I want to say uniform, but this is a commitment for our peoples in the state of New Mexico, that be recognized. What we're asking with the permanency and this committee is for that systemic transformation. And that we know takes multiple years. It's not just a one-time fix. It's not just, like as Jocelyn mentioned, this is a commitment to our community And that healing effort takes more time than 1 or 2 years. And we're hoping that within this process of the permanency commission, the commission and the equity office, that this would then lead to that systemic transformation within our state to really honor and be inclusive of the voices and experiences of our communities.
Thank you for that. Any more discussion questions?
I was just wondering if Senator Lopez could clarify. I see her comment in the box.
Senator Lopez.
Sure. When I was mentioning, what I was writing in the chat is that, and again, this goes to the comment that was made with regards to what the House has decided. The House and Senate have different rules. We operate a little bit differently. So if the House has a mandate, and you know, I know we have our majority floor leader with us. I think she was earlier too. So maybe she could speak about the House side. But for the Senate, we haven't decided at this point in time. But I would venture to say that many of our members would still like to have more than just a limit of maybe 5 total, if that's what the House is deciding. But we have not had that discussion yet. That's still forthcoming. And some of the memorials that we have talked about of not having is because we have recognized, sometimes we bring memorials up to recognize different groups within our communities. So, you know, it could be FHA, it could be a local Girl Scout group or something that we bring in and we spend time to recognize them, or a special person within our own Senate districts. That takes time and it's very important, but we may focus specifically on business such as this. Issues with regards to like the John Paul Taylor Task Force that has done some great work working with foster families and others in our communities. That's a memorial that we will be bringing up. And I think this particular memorial will also be brought up because it has a much more statewide impact. So those are things that we'll still negotiate, but each chamber operates differently and we have different rules of what we allow or what we won't. So I'm just speaking for what the Senate is at this point in time that we haven't decided. So yeah, this one should be in there. I hope that's clarified.
Are you adding to your workload, Senator Lopez?
Yeah.
Thanks. Thank you for that clarification.
Okay.
Are there any other comments or questions regarding this work group's plan?
I guess sorry to jump back in, but there is a sort of question at the bottom of the briefing template that Amy provided us with. That's, you know, are there any legislators that are supportive of this? Would that be a place we would list you, Senator Lopez, or do we need to do that? And would that be the right place that we could indicate that you're supportive of this?
I know I am one, but there will be many others that will be supportive of this. So you could list myself and, you know, I can't speak for my colleague, but I'm sure she's supportive of this too, but there will be, and others, maybe listing and others on there, because there are many others in both chambers that do support our work that we're doing here. And we'll get a lot of them to sign on it too. So it won't be just a couple of signatures. There'll be many, many who will be more than happy to sign on with us too.
Thank you. That was a really good question. All right. So there has been a suggestion that Regis Pecos with Cocha di Pueblo be added to the list. And I had saw Dr. Sanchez agreed with that. So if with that addition to the list of recommended members for the task force, is there a motion to move this forward?
I'm sorry.
We're also looking at the Office of African American Affairs.
Adding the Office of
With the internet going out today, we were back and forth with editing, and so things got dropped in the document that you're seeing right now. So that was one that didn't make the with the internet transitions, whatever.
Okay.
Yes.
Thank you for that. So with the addition of Regis Pecos and the Office of African American Affairs. Counselor Bencomo, your motion, and then
Second.
the second. Okay, all in favor? Rabbi Linnick. All in favor? Thank you. Anyone opposed?
Great
Thank
work.
you all. Thank you for your incredible work on this and the incredible discussion that's happened tonight. We will move to our last work group presentation for tonight before our health subcommittee, which is suggestions to legislators on bills presented. That would be the racial impact assessment bill that was presented by Senator Bill O'Neill and the memorial to study law enforcement. And I believe Jacqueline and Dawn are here. Do you have a report on that? Right.
So I am here, but we do not have our report. So my deep apologies. As a group, we did receive the one piece of legislation from Senator Lopez. And then as a group, myself, Dawn, and Joseph Cotton have yet to convene to be able to come together for what our recommendations are for that particular piece of legislation.
Thank you. Appreciate that, Jacqueline. I think at this point, what we appreciate your work on that and getting the materials together. So I think at this moment, are folks okay with tabling that discussion until the work group is able to meet on that, which means that that will not be in the report to the governor's office that is being finalized this week. We good with that? Senator Lopez, did you have a question or comment, or were you?
Madam Chair, I just wanted to ask, I think in a previous discussion that we had, there were some suggestions that if there were some changes to be made to one of the reports or additions, if that could be done by Friday.
Yes.
They're still within that time frame that maybe this group could get together, and if I don't know what their time frame is, everybody's busy. But could we do something maybe by Friday so that we could have it included within our report that goes to the governor?
Does that feel doable at this moment?
I don't know.
I know I can take responsibility in terms of working with my group and trying to move us toward that. And if anything, I can report back via email to this group about if that is not able to happen by Friday. I can be transparent in that. And so you all can hold me accountable. So I'll follow up with you all tomorrow afternoon once I hear back from my working group to see how quickly we can move that. But I know that I'm available too.
Thank you. Much appreciated, Jacqueline.
Mm-hmm.
Any other comments or questions regarding that? All right. Seeing none, we will move to the report by the health subcommittee. So Amy, if we can move them up as participants.
Can you guys hear me?
We can hear you now, and go ahead and take it away.
All right. Were you guys able to pull up on the rest of the subcommittee as well, or?
It looks like most, if not all, are here.
Okay, perfect. All right. Gosh, I really just want to start by thanking Governor Michelle Lujan Grisham for giving us this opportunity. I want to thank you, Madam Chairwoman, for your leadership. Definitely want to thank Kaylee and Amy for their patience and for their guidance, for sure, right? Especially their patience. And then I want to thank subcommittee. You guys for being so diligent and putting in some hard hours. I really appreciate it. So just to get started, we sent out the report last night, and hopefully, or 2 nights ago, I hope everyone had the opportunity to read it, look over it. There's a lot of information there. We had priority focus areas that were primarily around criminal justice, health reform, access to care, and workforce diversity, equity, inclusion, and anti-racism. Under each of those focus areas, we had some recommendations, or short-term and long-term. So my hope is that I can go over these and then we can ask questions at the end if that's okay. I'll take that as a yes. Perfect. So the first priority focus area, criminal justice reform. We looked at COVID-19 specific recommendations. Short term, we recommended active and immediate interventions to more aggressively reduce prison and jail populations in the time of COVID-19. That was a short-term recommendation. Our other short-term recommendation as it pertains to COVID-19 and criminal justice reform, health reform, is another short-term recommendation is recommend public access to data for each custody facility in New Mexico around COVID-19 infections, COVID-19 deaths, COVID-19 mitigation techniques as well that are undertaken by these facilities, as well as vaccination plans. And then the third category being racial and ethnic data about the people who are being affected. Another area that we talked about under criminal justice reform is medication-assisted treatment for incarcerated persons. So our first short-term recommendation was to recommend the initiation of an executive order to screen persons, in custody in a facility under the jurisdiction of the New Mexico Correctional Department or Corrections Department for substance use disorder, and provide evidence-based care inclusive of all medications assisted for treatment, including naltrexone, Suboxone, and methadone. Services should be initiated within 24 hours of arrival, and these should be extended past release. In other words, they would have to coordinate care with the community upon release. Our long-term recommendation under that same category is we're recommending that to advocate for statute that requires all incarceration facilities, so that's including jails and state prisons, to offer screening to persons in custody for substance use and provide evidence-based treatment. So the same recommendation that we made for the state prisons, but the long-term recommendation there would be for all facilities in the state of New Mexico. So that being our long-term goal there. Also under that, criminal justice reform is continuum of care. So our short term there was recommend an executive order mandating reinitiation of Medicaid in every eligible person upon release from prison, sort of following the guidance of SB 42 that was passed in 2015. Okay. Our long-term goal as well under that category, before we move on to focus area 2, is to include LGBTQ plus representation on the Gender Assignment Committee for New Mexico Corrections Facility. As right now they consult, but I think it would be best to have representation on that committee, or we feel. So moving on to priority focus area 2, which is access to care. Starting off with COVID-19 specific recommendations. Short term, recommended expanding COVID-19 protections, including vaccine availability and prioritizing communities of color and all essential workers, including low income essential workers. If you follow this to Appendix 2, it would connect you to the current vaccine strategy, which doesn't include a lot of low-income workers, particularly jobs where are dominated by people of color. So we felt that was an important recommendation to make. So short-term, another short-term goal was to ensure that all COVID-19 testing and care continues to be free for all New Mexicans, including uninsured residents and regardless of immigration status. So that's the case right now, but we wanted to emphasize we want that to continue. Short-term goal number 3 in that category is to ensure coverage of all COVID-19 treatment for uninsured New Mexicans, such as expanding New Mexico Medicaid's definition of emergency under the Emergency Medical Service for Aliens Act. We thought this was important to do because it expands it beyond the emergency department and inpatient stays to all COVID-related care, including post-hospitalization, follow-up visits, so on and so forth. Expanding access to insurance coverage and reducing out-of-pocket cost was our next big category under access to care. So short term, we recommend making insurance more affordable for those who are currently insured, provide affordable options for people that fall in the family glitch category, and offer affordable coverage options to undocumented residents. Which kind of falls into the next category, utilizing funding from health insurance premium tax to implement a Medicaid buy-in plan or a similar policy plan that enables access to health care for undocumented immigrants, as well as the previous categories that I mentioned, and uninsured folks and those who fit into the family glitch. Our next short-term goal was to support legislation that extends the working family tax credit to families with young children, to younger workers without children, and to immigrant taxpayers who file under ITINs. Our 2 long-term goals under that category are recommend legislative solutions to prohibit medical debt collections from hospitals for anyone making under 200% the federal poverty line. The COVID pandemic has stopped aggressive debt collection, has not stopped, I apologize, aggressive debt collection. So then our other long-term goal under this category was to recommend legislative solutions to cap the upper limit of costs for care for patients with hospital bills. Expanding access, recommend as a short-term goal, recommending concrete steps to create a paid sick leave and family medical leave, as recommended by New Mexico Voices for Children, SOMOS, CAFE, El Centro, I'm just going to say El Centro, and Southwestern Women's Law Center. And we do have that article connected to the overall recommendations as well. And then another short term is recommend implementation of a 24/7 access crisis triage center, offering medical health support, sobering services, and connection to addiction treatments in New Mexico. Bear with me. I appreciate your patience so far. Another short term is recommend supportive legislative solutions to eliminate the criminalization of abortion. and to increase access to behavioral health by funding mobile behavioral health clinics for Native Americans that can be utilized to provide medication-assisted treatment and counseling. Expanding access to medication for opioid use disorder and reducing opioid-related deaths is our next large category. Short-term, recommend requiring that residential treatment centers in New Mexico, as a condition of licensure, offer on-site access to medication-assisted treatment and off-site access to these treatments, including buprenorphine, naltrexone, and methadone. I recommend creation of a standing order through the Department of Health for EMTs and first responders to administer Suboxone with consent after reviving someone from opiate overdose. Recommending development of incentives for hospitals to provide buprenorphine in the emergency department and build hospital health system-wide capacity for treating opiate use disorder. And then long-term under this category was decriminalization of diverting buprenorphine medication, medication used for treatment of opiate use disorder, from the misdemeanor crime of possession of narcotics. Our last priority focus area is workforce diversity, equity, inclusion, and anti-racism. So short-term, recommend exploration through a Medicaid waiver or other mechanisms as seen fit of a pay differential for services provided in a language other than English, to the added complexity and necessity skill set for providers in health services, so behavioral health, who are bilingual. Long-term under this category is recommending that the Department of Workforce Solutions create incentives for community-based pipeline programs, such as paid internships, mentorships, and apprenticeships that show success in helping underrepresented minority groups, including Native Americans, Latinx, and African Americans, achieve entry-level careers and achieve success in matriculating into the health profession schools. Long-term categories under this recommend that higher education department increase state funding for loan repayment programs, such as the Health Professional Loan Repayment Program, that reward healthcare providers to continue to provide healthcare in underserved areas in New Mexico, and to recommend that the legislature study the feasibility of creating a parallel programs to the UNM BA-MD program. So looking at a BA-MD program sort of equivalent for nursing, pharmacy, and other allied health groups with preference for New Mexican students. So I know that was a lot. This was altogether, this was 23 pages. We didn't have, I feel, an easy task, just because, when you look at medicine, only 15% or so, via estimates that I've read, are related to healthcare per se. And a lot of health is related to the social determinants of health, right? And that's what we're looking at addressing more, since it has a much bigger impact. So I'm looking forward to you guys' questions and hearing feedback on this. Thank you.
Thank you so much, Hussein, and thank you and all of the members of the Health Subcommittee for all of your incredible work. I had the opportunity to sit in on some of your meetings. Thank you for allowing me to be a guest there, and the conversations you all held were in depth, and the knowledge of the committee members just astounding. So thank you for this incredible report and all of the work that you all put into this. I wanted to give a moment if there were any of the other subcommittee members that wanted to say anything before we open up for questions and comments.
This is Margaret Montoya, and I just wanted to begin by echoing Hussein's recognition of the support that we had from Amy and Jane Wishner, but particularly from Kaylee Salazar, who really is responsible for pulling this document into the coherent and organized document that it is. And thanks to her for helping us throughout the meetings. This was a process in which I learned a great deal. I want to thank the other subcommittee members because I thought the discussions were really in-depth. And we had the challenge of really trying to figure out where there is so much need in New Mexico that can be connected to health. You know, how do we go about really establishing some priorities? And just like Hussein said, much of what we're talking about are about the social determinants, the fact that there's a widespread poverty, but certainly one of the social determinants that needs to be named is systemic racism. That not only does it show in stress, that has a somatic toll, but also the great need for behavioral health in the communities of color. We have in medicine been talking for a very long time about cultural competence, but today the new way of addressing systemic racism is through what is called structural competence, and it's really engaging institutional and structural racism. And I think you see in our recommendations some reflection of that focus. Thank you.
Thank you so much. Any others? If not, we will move for any questions or comments.
Thank you, Madam Chair. I was hoping someone else would in front of me, but I will jump if no one else will. I am just so thoroughly impressed. Like, that was incredibly holistic and just really well thought out. So thank you all so much for your work in this. I mean, it's exactly like, as a policymaker, having people who are closest to the issue come up with these recommendations is just the best thing you can ask for. Also, though, as an immigrant and as someone who works with immigrants, I wanted to thank you for making it as inclusive as possible. Every single thing you mentioned that was like to include immigrants regardless of status, that was incredible for me to hear. And so I really wanted to say thank you in terms of that. And then I'm also the executive director of New Mexico Cafe, which is one of the groups that's working along with my colleague Marianne from El Centro de Igualdad y Derecho. But we're working on the paid sick leave policy, and to me, I was really glad to hear you include that, because it's very much a huge racial justice issue, especially when you consider essential workers and that most of them are people of color. And what I've been seeing in Doña Ana County is that people have been afraid to go get tested because they're afraid they're going to lose hours and then not be able to pay bills, or they're afraid that once they've tested, they keep going back to work, right? It is a public health issue that people don't have access to paid sick leave. And so for you to include it in this, I think is huge and powerful. And I really wanted to thank you for that. And my last question or only question will be if you had conversations at all about economic relief in your plan. I think economic relief during COVID is also a public health issue, right? People being able to have access to any kind of cash assistance at the state level, and especially making it inclusive, right, for people who've fallen through the cracks, like undocumented folks, or the very low income people who've suffered from chronic unemployment, right, who didn't have access to unemployment benefits or even that federal stimulus check, which at this point, those $1,200 seem like they were forever ago, right? And so I'm just curious if that was, given how inclusive this was, if you had talked about economic relief. Thank you so much.
And I'll ask this, and thank you for that question. I really appreciate it. I'll ask the subcommittee. Is it okay if I take this one?
Sure.
All right, perfect. You know, we did give it thought. The difficulty was, I think probably one of the more challenging things was each of us had a 4-page long list of recommendations, and attempting to prioritize was very difficult. One of the things we had looked at was there was a large portion of people that were excluded from the Families First Coronavirus Relief Act. Among those were people that are designated as contract workers. A lot of these people are at highest risk of acquiring coronavirus due to exposure. So in this list are people who work in houses, so like maids, people who are home health aides. So they're not included in every talk when they talk about healthcare workers. They don't count home health aides, sometimes not home health nurses. It was a tough thing to not include this. And I think we ended up talking about the paid or recommending the paid sick leave. I'm not going to say in lieu of this, but as a stronger recommendation for a more permanent fix, as opposed to making a recommendation for, you know, a $1,200 or to fill the gap for the Families First Coronavirus Relief Act. And then when that's done and gone, that we're back to the same problem we were having. So that was my thinking behind, you know, us not putting that there. And I'm speaking for myself, not for the whole group, but I'm interested to see what anyone else has to say.
So can I add information about the Working Families Tax Credit? And so we had input from Voices for Children, and they wrote a letter supporting, asking us to support this. And really, it's likely that the legislature is going to expand the WFTC from 17% to 20% of the EITC from the federal government. That's a very important way of getting money to low-income people. What's important is that it's statutory, right? But what we need to do is we need to close some of the gaps. And so there are gaps with respect to younger workers without children, immigrant taxpayers particularly, right? It's those that file under the ITINs, as it says. But I think that if you go to the report that has been written by Voices for Children, you will see that there are other corrections that need to be made, because right now predatory lenders are really, you know, they are, as it says, preying on this population, because this population needs cash. And what they do is they are not well advised, and they go and get these loans that are very high interest, but frequently because they need liquidity, they need the money. So there are some other things that need to be done, but it's also true that the legislature has been fairly responsive to getting money via this particular avenue, this mechanism. But thank you for the question. Yeah, and perhaps we should add something in here, encouraging the governor to really put pressure on the congressional, you know, on our representatives to increase, you know, the support that people need, which doesn't seem to be coming.
Just to add to that, Thank you for those words, Margaret. This is Anjali Taneja. I'm on the committee also. And thank you so much also for those questions about economic relief. That's so, so critical. I will also say that the work that we've put into recommending expansion of healthcare access directly ties in with economic relief, as medical bankruptcy is still the #1 cause of bankruptcy in the country for anybody insured or uninsured, and especially for people with overwhelming medical debt who don't have access to health insurance. So just adding that piece in also.
Thank you. Any other questions or comments? Bishop Cooper, I thought I had seen you unmute before this last question, but perhaps I was wrong.
No, I am muted. That was a tremendous report. I just thank that subcommittee for all of this hard work, to echo everyone else. I did have a question about, well, a comment about the UNM BAMD program. When it was originally started, it really was tailored for people of color. And I want to make sure that if we do something with the other students in a recommendation that that language is included in that. That's it. Otherwise, excellent report.
Thank you, sir.
All right.
Fatima.
First, again, just to echo everyone, thank you so much for this incredibly thorough and well-prepared document. So I just really appreciating the wisdom that you all have brought to this. And I had 2 questions. The first was, I work with the statewide Women's Fund and Foundation. So we hear a lot from the communities that we work with about poor birth outcomes for women, and particularly for women of color. And nationally, we see this, and in New Mexico for Black women, for Native American women. And, you know, a lot of that's the social determinants that you mentioned. And then we also hear folks talk about just bias on the part of practitioners and medical professionals, and things around pain and expectations around pain and things like that. And so I'm wondering, in looking at the recommendations, did you have any discussions? And, you know, I'm not in the medical field at all, but did you have any discussions around training and education? And I don't know what that looks like in terms of, is there a framework that is really deep around equity and racial justice in training programs for medical professionals, and that can maybe offset some of that bias? So that was my first question. And then my second question was really around the social determinants of health. And, you know, in a health equity framework, we have the belief that there should be health in all policies. And so I'm wondering, you know, so much of our health is decided outside, as you said, of the medical establishment or outside of the doctor's office. And I wonder if there's a recommendation we can make that, you know, at the legislative level, when we're considering policies, that similar to, we've been having conversations about racial justice assessments of legislative priorities and policies, and if they're health assessments, you know, for things that are around, say, oil and gas, or things that where health doesn't usually enter into the conversation, but is actually quite important and central. So I'm wondering if there's like a broader, you know, recommendation to be made of health in all policies. Thank you. And thank you again. This is just incredibly thorough, and so honored to read these recommendations.
So if I may, the report that the task force on the land grant permanent fund submitted has a health equity impact assessment as an appendix. So there is definitely a model for doing that. And there had been some consideration in the legislature to require health equity impact assessments for every debated bill. But I was hoping that, in fact, that would be picked up under the racial justice impact assessment, right? That there would be a broader category than health that could, you know, that recommendation could go to the legislature. there has been a lot of work done at the medical school and around the country on anti-bias training. We find that much of that training is very episodic. It's not included in the curriculum. It's frequently voluntary, and the people that, at least that I have seen over many years that I've been involved in this, seem to be the people who are probably the ones who need it the least. But I certainly agree with you that we can add this to the report. I think that provider bias, it's been studied enough so that we know from the report coming out in 1990 on unequal treatment that provider bias is definitely responsible for, lower health outcomes. I mean, that's already been established. But if you're making that recommendation, I think certainly I would be very open to having us, I'm not speaking for the whole subcommittee, but certainly as someone who's worked in this area for a very long time, I agree with you.
Hi.
Yeah. Oh, please go ahead.
This is Representative Stapleton, and Ms. Montoya, I heard you earlier, not what your statement you just made, but the earlier statements that you made in regard to those unfortunate and those that in need and the services that is required for them, and are they or are they not getting it? And I just wanted to let you know that we as legislators are about to go into a special session, and that's the whole purpose of that special session is to make sure that we can provide for those individuals in our state right now that are not getting services or not getting support and help that they do need. Thank you.
Thank you, Representative sorry. Thank you, Representative Stapleton, for that statement. I was wondering if I could address the question that was asked prior to that about maternal outcomes and provider bias. As Professor Montoya said, she said something and she said it earlier that resonated with me, and has really sort of changed the way I look at how medicine is practiced, is that looking at it instead of from a provider competency standpoint or level, right? So instead of addressing every provider individually on their bias, having structural changes or competent systems, right? So if hospitals mandated that people had this training, if they mandated policies that said, you have to give these medications, or you can only give these medications in these scenarios. So I'll back up, specifically as it pertains to pain. So there were studies that were done that looked at pain and medication administration. And when they had policies that said you did a tiered report approach, as the World Health Organization would recommend, that people were more likely or less likely to get opiates and more likely to be treated fairly. So when you have policies like this in place with the intent of addressing inequity or injustice, then they tend to work, and you have something that you can sort of modify. If you are depending on each provider to do, I don't know, whatever's expected individually, it's kind of hard to know where to fix if there's a problem. So I definitely see what your recommendation, and I think it would be a very big task, but certainly a task worthwhile approaching. So thank you for asking that question.
I saw Dr. Tanasia and Brian Cerna unmute.
Thank you. I would just add, Fatima, to what you said is so important, and we can figure out language to stress the importance of this is a long-term process, thinking through how we, I would even go farther than bias. There's racism baked into our healthcare systems. It's very baked in, and it's an institutional problem, and it's just also part of life, how we all train in all of our different areas. And solutions to that are wide-ranging and expansive, and we can definitely, or I'm speaking for myself, it would be great for our committee to put some language in the report around that. And the one area that we did try to really beef up around what we put in our recommendations was around workforce. And studies after studies show that a workforce that more represents the population of patients who are being served inherently has less bias and racism baked in. There's a connection, there's an understanding, there's a shared lived experience, and a different kind of worldview. So there are community programs and other things that have been really phenomenal in training up the next generation of behavioral health care providers, the next generation of healthcare providers that we're hoping the governor can work on incentivizing, in addition to what Workforce Solutions is already doing in terms of formal federal apprenticeships and other solutions that fit certain criteria, but don't necessarily fully capture how we can best engender and support the next generations of providers who look more like our community in New Mexico and come to that work more inherently with I think, an anti-racism framework. But there's so much that needs to be done at the institutional level also, and would also be really interested in hearing any suggestions you have around how that wording could look like for the larger piece around that.
Brian. We can't hear you.
Can you hear me now?
Yes.
Okay, so sorry. For my part, some of my comments were going to directly echo what Anjali just said. But in our recommendations, one thing that we do, that we put in there to try to address that is incentivizing services that are provided in a different language other than English, to where there is an actual pay differential for people providing those services, which really, it does set a precedent for the value of providing cultural and linguistically appropriate services. But I completely agree that if we really want to change these systems, we have to change who the care providers are. Not that, we want to disincentivize any care provider. We need everybody's help. We need all hands on deck. But we do need to address some of the disproportionate numbers between who's providing care and who's receiving care. And in behavioral health especially, I know that there's a huge mismatch between who's providing behavioral health care and who's receiving behavioral health care. And so that's all I wanted to contribute.
Thank you. Any other questions or comments for the Health Committee?
Can I just reiterate that I think it would be very helpful to the kinds of conversations that are going on in health sciences, and particularly in among the students about curricular change, about really having an anti-racist focus. It would be very helpful, I think, if the community expressed the concerns around provider bias and really provider preparation, right? And, Dr. Patel is in as good a position as anyone to, I know that he's been involved in those conversations. But making this kind of change within institutions frequently is very long-term. And I think the community voice has been missing from the conversations we've been having. Thank you.
My dog agrees as well. Thank you for that comment. Sorry about that. I apologize for that. Okay, any more questions or comments? If not, Hussein, do you have a final statement you want to make?
I mean, I just want to echo again, I'm really appreciative for, the committee members, the subcommittee members, your leadership, Governor Lujan Grisham giving us the opportunity. And I left Jane out earlier. Jane has been instrumental in helping us sort of progress, and she's a fantastic resource. So I really want to thank her as well. Can I give one more plug for COVID? I think it's important that we have these conversations with our loved ones in regards to social distancing, wearing masks, the importance of sort of staying home, because these numbers are skyrocketing. And, we don't have the resources New York has or other states have. And if we go down that road, I don't know what it's going to look like. So, I think I'm having these conversations with people who aren't listening very, very much, just because they barely know me. But I think it's important that we get out there and have these conversations with our loved ones and our friends. So I just wanted to say that.
Thank you. And thank you to all of you who are working on the front lines right now and our healthcare providers and heroes. We appreciate you. And again, to the subcommittee and the staff who's helped on this, thank you so much. At this time, if there's no more questions or comments, I think we're ready to move to accept the health subcommittee's briefing memo and recommendations.
So moved.
Thank you, Bishop Cooper. Is there a second?
Second.
Thank you, Marianne. All in favor? Anyone opposed? And 2 thumbs up. I like that. Awesome. Thank you so much for your work on this. We have quite a comprehensive report. We have a lot of comprehensive reports. You all on this council and every committee and work group has done a tremendous amount of work, and you all have shown up here every 2 weeks. I see Amy on camera. Amy, I was going to move to just kind of talking about process next. And so I don't know if you want to lead that off, or I can.
Yeah, I think I just wanted to let folks know that the Commission on Civil Rights, which, in the very beginning, we tried very hard to make sure that their work and our work did not overlap. But now that we're getting to the end and to the end of this section, not to the end, and they're getting to the end of their mandate, we're trying to work on either a joint meeting for our next meeting, which is on December 2nd, or at minimum for them to provide us with their report. So that is our hope for the next meeting, is that will happen. Again, we're still working on scheduling that. So I wanted to make sure folks know that that's what we're working on, and that we will still meet next week.
Well, in 2 weeks.
In 2 weeks.
On December 2nd. Yeah, on December 2nd. Thank you for that, Amy. And so going forward, we have the 3 subcommittees, priorities and recommendations, and all of the work groups plans that have been approved. Those are going to now be compiled into one report and themes pulled out. And all of the chairs will be of the committees, of the subcommittees, and of the council will be presenting to the governor's senior staff on Friday, which is why we didn't have much room for any more changes, because we need to start, and I'll give all the praise to Amy, Kaylee, Tammy, and Shawnee, because they are the ones that have been doing all of that work to compile everything that you all have now approved to be moved forward as recommendations. And then after the December 2nd meeting, where the Civil Rights Commission is able to hopefully join us and present, we will take a recess through the end of 2020 as we vision and have direction of how we move forward as the council. Does that sound good? Like a plan? Awesome. Any comments or final questions or comments for this evening?
Yes, I have a question.
Yes, Representative Williams Stapleton.
So you just mentioned that you will take a brief leave until January, I assume is what you're referring to. So what's happening with policy legislation out of all these subcommittee reports and the concept that there would be legislation in this 60-day session, or will there not be?
That's a really wonderful question. I believe in reviewing all of the reports. Most of the legislation that has been recommended through the council and all of our various committees and work groups are things that have been identified that are being introduced in the legislative session for 2021. Does that answer your question?
And then there have been members of the legislature that the groups have been deciding who would be carrying or who's relatively influential with those, knowledgeable with those kind of subcommittee groups, policies? Okay.
Yes.
Okay.
I do think, though, Representative Stapleton, thank you for bringing that up, because that is something, and again, we need to wait and see what happens with our recommendations and, you know, having conversations with the governor's office about how to proceed. But what I am hearing you say is we are not done, right? And so that while we should really sit back and enjoy our Thanksgiving holiday, or enjoy, you know, the holiday moments that it takes to get to Christmas, that we should remember that, you know, as a council for racial justice, that our work does not stop, and that you will be called on to do more. And so this is where we just don't know yet how we will call on you or what we will ask on you, but there are so many ways that we can ask you to be involved, right? There is ways that we as a council can put out op-eds, or we can send out education information to our legislators, or we can ask our legislators, you know, of our own home districts and things like that. So, you know, we on the support side will be coming up with those things while you all take breaks. And then you will start seeing emails and requests and all of that come from us to support the recommendations that you move forward after we have, you know, approval from the governor's office on which ones we should really focus on.
Yeah, thank you for that, Amy, and thank you for that question, Representative. Yes, Fatima. So I would suggest that any edits to the briefings happen by tomorrow noon, because the compilation of all of the reports, I think it's 10 or 12 of them, has to happen tomorrow. Yeah, it has to happen tonight, really. But if you can get them in early tomorrow, that would really be helpful. I think anything by Friday won't make it into the edits, because we will be meeting then. Yes, and so that break is not this is not the sign off of this council's work. We also acknowledge that we ended up having to move fairly fast to get some of this work done in advance of legislative session, and so for everyone to take a deep breath so that we can really talk about what that framework is moving forward. And I suggest Amy, Shani, Tammy, and Kaylee, you also take a deep breath for a moment because you all have helped do a major lift here. So any other comments or questions? Senator Lopez.
I just wanted to say thank you to everyone for your time, your commitment, and what I call the querencia that comes from the heart, the soul, and the love that we have for our people. I just want to say thank you to everyone, Madam Chair, and everyone. Thank you so very much. And we're coming up on a day of Thanksgiving next week, and I hope that everyone takes the time, please, to spend with your family. We're grateful for what we have, but there's still so much work to do. But I think we do have a blessing with each other, and I just wanted to share that and just say thank you to everybody here, and a blessing be upon each one of you. Thank you.
Thank you, Senator Lopez. That's a beautiful blessing. All right, any final comments? I also just want to give my deepest and sincere gratitude and thanks to each of you. It has been truly one of the things that I look forward to the most is being in community with you all. And it's just tremendous, the conversations we've had and the work that everybody has done. So thank you so much. My heart is like expanding right now. Lots of expansiveness there. So I really appreciate you all, and I wish you all much health and safety and joy in the week to come. Have a good evening, and thank you for your time here tonight.